Ladies and gentlemen, good evening. Let me take this opportunity to thank the organizers of this evening's public lecture for the confidence reposed in me, for me to share my thoughts on the presentation of an older brother. I will try not to be intimidated, but to be objective. Kwame does a great job in his presentation by walking the audience through a journey down memory lane since 1993 to date, but by carefully refreshing the memories of the older generation and perhaps inform the younger generation of the holistic healthcare vision of Dr. Kwame Nkrumah, the first president of this nation. He then goes ahead to ask a number of questions which pertains to the tenets of democracy in the area of healthcare, with specific emphasis on outcomes, which he calls democratic dividends, healthcare dividends, under the Fourth Republic. The outcomes he uses 6 outcomes effectively, 5. Life expectancy at birth, maternal mortality, infant mortality, under 5 mortality, and survival to the age of 65. So he compares the trajectory of these indicators with that of a selected African countries, and the countries are Rwanda, Sudan, and Liberia. So an objective question one would ask is, why pick these specific countries? I believe on the sidelines, the conversation had been, these countries have gone through civil wars, so they have had to come from a very deep place, whereas Ghana has not gone through anything like that. And so another criticism that comes up straight from the presentation really is that if you just pick indicators like maternal mortality, life expectancy at birth, and then you compare Ghana in 1993, and then you look at the figures in 2000 or 2020, and say that the percentage increases in these countries are higher than the percentage increases in that of Ghana, it's a bit problematic in terms of methods, because if you are coming from a lower base, then your percentage increase would be higher than someone who is coming from a higher base. So in that sense, it's more like it is easier to get to the top, but maintaining the top position or being there requires a lot more work. So he steps back a bit to compare Ghana in 1960 to get away from that whole box of criticism around just percentage increases. He looks at Ghana in 1960 to Singapore at the time, a country at the time where Ghana essentially had an upper hand in terms of longevity, because Ghana had a higher percentage of persons above 65 in Ghana than in Senegal. So to me, the most compelling aspects of all this is the fact that Ghana spends significantly more on health per citizen than all the selected 3 countries he looked at. Essentially, Ghana spends, the health expenditure per capita is $84.98, compared to significantly lower figures reported for the 3 other countries. So, as an economist, I ask a number of questions, but we also note that this funding comes from a place, the national budget. And historically, Ghana has persistently run budget deficits, which are financed through borrowing. I am sure nobody here is stranger to the word domestic debt exchange. Essentially, the debt situation is because of the significant shortfalls between revenue and expenditure. So as the country struggles to deal with issues of revenue mobilization, which is persistent when you go through the data, particularly with emphasis on the Fourth Republic, one would expect that we'll place a lot more emphasis on prudent expenditure management. Prudent expenditure by emphasizing on good value for money. And from the data in the healthcare sector as presented, it is quite evident that Ghana spends more on health with far less returns in terms of health outcomes, where these health outcomes have been beautifully articulated. So I am not surprised that the health outcomes that we see are not great, and at best, it appears we have been quite sluggish in the growth whilst others are growing faster in the right direction. Why? Because we know that development is a continuous process, and development which must translate into high incomes for citizens, good education, better health outcomes, and social security for all. It's a continuous process. But when you track the growth trajectory of this country, it has been quite checkered. So there is the need under this democratic dispensation to look at the sources of vulnerability. What happens to the productive sectors of this economy that makes the economy struggles to grow in the right direction, to yield some of these dividends, including healthcare outcomes. The health of every nation is in no doubt its greatest asset. A healthy population reflects in a healthy labor force with important implications for productivity and decent work. Healthcare, just like education, is a human capital investment because it translates directly into the ability of the population to generate wealth. Indeed, in the discussions on development indicators, the literature has now moved on from income to place a lot more emphasis on other indicators of development, such as health and education, because it is evident that income alone is not enough. It's a necessary condition, but it's not a sufficient condition for development. So in the development discourse, the emphasis now is on multi-dimensional measures of development. And here we can talk of a typical example of the Human Development Index. So I sort of checked on the Human Development Index, which is also a composite index which takes into account income, education, and health. I know that the emphasis for this evening is on health, but when you take a composite index like the HDI, you find that essentially, although Ghana has a slightly upper hand over the comparator African countries, Rwanda, Liberia, and Sudan, it is significantly below that of Singapore, because the figure for 2022, Ghana's HDI is 0.63, Singapore is 0.94. And this is a country that we showed this with years ago, as of 1960. So I would not want to belabor the points in concluding on my remarks on the presentation. A number of burgeoning questions come out from the presentation for me. One of them is that if Ghana is spending more with a higher health expenditure per capita, why are the outcomes lower than the comparator countries? Is the country spending on what is at the core of healthcare in the country or something else in the name of healthcare expenditure? So in this instance, the emphasis should be on efficiency in healthcare expenditure. Does the country spend on particularly expensive aspects of healthcare systems compared to the comparator countries? Does the country unduly focus on, for example, hard infrastructure to create access, while not necessarily focusing on the quality of healthcare that is available to the citizens? What is the role of technology in this day and age of technological advancements? How is the country taking advantage of technology to bridge the gap between access and quality, whilst introducing efficiency in healthcare expenditure? I believe these and many more are the questions that beg to be answered, and the lecturer this evening has beautifully articulated them. I'll end my remarks here. Thank you.